Hello, I'm Rita Garland. I've had 35 years experience in medical billing, so I'd like to share some information about Medicare and coverage when you do turn 65. According to Fidelity Investments, a 65-year-old couple retiring today will spend on average a total of $275,000 out of pocket on health care. Working past 65, you can still obtain health insurance through your employer. At 65, whether you're working or not, you need to sign up for Medicare Part A. If you retire at 65 or later, you are eligible for Medicare Part A and B. There's an initial enrollment period known as the IEP. So 3 months prior to turning 65 and 6 months later, this will be your IEP. If you don't sign up for the Part A and Part B, if needed, penalty will be assessed to you for not signing up during the IEP. Medicare pays 80% of negotiated fees, so you'll also need to consider a Medigap plan that will pick up the additional 20%. Some of them include AARP, Blue Cross Blue Shield, Mutual of Omaha, among many other ones. When you're 65, you need to start looking at all the types of Medicare that are available. The original Medicare that most of us are familiar with include Medicare Part A, which covers hospital, nursing facilities, hospice, home health services. There's an annual deductible, and in 2019, it's $1,364. Part A will pay 80% of a negotiated fee, leaving 20% as a patient responsibility. If you worked for 10 years or 40 quarters, your premium is paid through the Medicare tax that you've been paying all these years. Medicare Part B covers doctors, ambulance, lab and imaging services, durable medical equipment such as oxygen or wheelchairs. There's an annual deductible of $182. Again, Medicare pays 80% of negotiated fees, leaving 20% as patient responsibility. Again, for Part B, there's no out-of-pocket limit. The premium for Part B is approximately $135 a month for 2019, and this is usually deducted directly from your Social Security payment. Medicare Part C is relatively new. It's also known as Medicare Advantage, and this replaces the Part A and the Part B of original Medicare. It's similar to a managed care plan that you may have had as an employee. There's no deductible in most plans, but you will have a copay. An office visit may be $10, $15, $20. The cost averages about $135 a month. You also have other coverage with the Medicare Advantage. Some plans include dental, prescription, and vision and hearing aids. Medicare Part D is the Medicare prescription plan. The price and coverage vary from company to company, so you'll need to do your research and see if your medications are covered by the plan and what your cost will be.